Welcome to Optimum TV. My name's Nick Bastin, and I'm delighted to be joined today by Andreas Wolf, Chief Technology Officer of numares Health, the transformative metabolomics company pioneering multidimensional biomarker insights from nuclear magnetic resonance. Andreas, great to have you with us today.
Hello, Nick. Thank you. Thank you for having me today.
Fantastic. So today is Global Fatty Liver Day. Could you tell us a little bit about how numares technology is helping to play a critical role in the detection of liver disease?
Yeah, thank you, Nick. On Global Liver Day, I believe it's really worth asking the question why there are so many patients still being diagnosed too late. And the answer to the question is largely a diagnostic gap. We at numares believe this diagnostic gap can be addressed by NMR metabolomics, a technology that analyzes hundreds of signals from one single blood collection tube using nuclear magnetic resonance spectroscopy. Basically, you can think of it as a metabolic fingerprint of the stage of your liver.
Great. So how does it help identify MASH? So it's from one single blood collection point.
Well, the liver starts sending metabolic signals long before a damage of the organ is visible within a biopsy or a imaging technique, for example. NMR picks subtle shifts within the lipoproteins, the amino acids, and other small molecules that reflect the dysregulation in lipid trafficking and insulin signaling and inflammation. And these subtle shifts can be read by the numares platform in order to generate a pattern that can be learned by machine learning algorithms in order to detect early stage liver disease from the very beginning. The key really is that we don't look into the elevation of single biomarkers, but in the recognition of complex metabolic signaling.
Fantastic. And how sensitive is this approach in terms of identifying, particularly those silent MASH patients who pass the kind of standard lipid or liver function tests?
Yeah, this is probably the most important clinical gap numares is trying to address. Most standard liver function tests measure liver enzymes like ALT or AST. However, they are insensitive to early or moderate stages of liver disease. Liver disease patients with steatohepatitis can have normal liver enzyme levels. And most critically, this can happen at both ends of the disease spectrum. In early stage diseases, enzymes are not yet elevated because damage is still subclinical. In end stage cirrhosis, however, they can normalize as functional liver mass is already lost. NMR metabolomics, however, takes lipoprotein subfractions and many other molecules in order to reveal metabolic perturbation where other liver function tests are simply not designed for.
Fantastic. And can you tell us a little bit more about the kind of the role of your constellation sort of biomarkers in helping to identify MASH in these patients?
Well, MASH, as many other diseases as well, is a multifactorial disease. And it involves liver lipid overflow, oxidative stress, dysregulation in the gut-liver axis, insulin resistance, and inflammatory cascades. And it is very difficult for a single biomarker to capture all that complexity. We at numares address that complexity holistically we don't ask if a single biomarker is elevated or downregulated. We ask if a pattern that we see matches to a certain disease state. And this multivariate approach of analyzing hundreds of biomarker relations gives us the discriminatory power that other simpler biomarker assays don't have.
Great. And do you think that this that your approach could replace the kind of biopsy-led kind of mass population screening that we've seen to date?
Liver biopsy is still the reference standard in staging and confirmation of MASH, so that has to be clearly said. However, there are other techniques that can be used and that are less invasive as biopsy is, like elastography, in particular the FibroScan, for example. However, they do have certain limitations. One is accessibility, as not every primary care physician has a elastography facility available. So patients have to be sent to secondary care in order to get further investigation. Secondly, ultrasound or elastography requires ultrasound. And ultrasound requires the probe to be close to the organ. In that case, it's the liver. However, those patients who need non-invasive assessment, most importantly, are patients who are obese. And obesity prevents the ultrasound from having a proper signal, resulting in lower accuracy. Using NMR technology, we don't have that kind of limitations. NMR can assess the liver function from one single blood draw in primary care, and it is totally independent from body composition or the BMI. So therefore, patients can substantially benefit from the capabilities of numares technology in triage and screening, because we can identify those patients who truly need further investigations and those who would need immediate treatment. Well, and ultimately that is why we believe numares technology makes population scale screening feasible. In a way, neither biopsy or elastography can achieve it.
Well, that's a fantastic thing for us to look forward to and make patients' lives certainly a lot easier and less intrusive without having to have those unnecessary biopsies. So thank you so much, Andreas. Great to have you here, and thank you for listening.
Thank you very much for having me.